Hello, my name is Diana Nicole Chiriguayo Palis. The topic to be discussed is how to alleviate health trauma. Definition: an affectation of the brain caused via an external force that can produce a disgrace or dysfunction of the level of consciousness and that entails an alteration of the cognitive, physical, and or emotional abilities of the individual.
The Glasgow Coma Scale, or GCS. There are many different assessment tools for neurological function. However, the most widely known and used tool is the Glasgow Coma Scale. The GCS sees a patient assessed and scored in 3 areas of neurological function. 1. Eye opening. 2. Verbal response. And 3. Motor response. The highest possible GCS is a score of 15, which reflects an individual who is fully alert, aware, and orientated. The lowest possible score is a 3, meaning the person is unconscious and unresponsive. So, let's look at measuring the person's eye opening. Do they open their eyes spontaneously like normal? 4 points. Do they only open their eyes when you speak to them or in response to noises? 3 points. Do they only open their eyes to a physical or painful stimulus? 2 points. Do they not open their eyes to anything? 1 point. Verbal response. Does the person know when it is, where they are, and who they are? 5 points. Are they confused? Was their answer to the time, place, or person incorrect? 4 points. Do they respond with the wrong word to your questions? 3 points. Is the person making only incomprehensible sounds or moans? 2 points. Is the person not making any noise? 1 point. Motor response. Are they able to follow a command? 6 points. Do they localize to a spot when a painful stimulus is applied? 5 points. Do they withdraw from the painful stimulus? 4 points. Does the person react with an abnormal flexion? 3 points. Does the person respond with an abnormal extension? 2 points. Do they have no response to painful stimuli? 1 point. To learn more, subscribe and visit osmed.com.au.
Applications in physical therapy. The physical therapist will work with the patient, family, and other health care providers to develop goals and individualized treatment plan to address the challenge and function limitations associated with the injury, depending on the severity of the injury, the patient level of consciousness, and the problems the patient has. The treatment plan will widely vary.
My name is Amanda, and I'm Nika, and we are physical therapists here at Vibro Rehabilitation Hospital of Denver. Because October is PT month, we want to talk to you about how physical therapists can help someone recover from a traumatic brain injury. After someone experiences a traumatic
Pros and cons. Pros. If the injury is mild and physiotherapy care is immediate, the patient's recovery is faster and the patient's integration into his normal life. Cons. Likewise, if the injury is seriously, the rehabilitation and recovery time is longer and requires more attention.
Your brain is not just fixed and sitting there; it's kind of floating, and so you can like get hit, and so maybe like in a car accident, you swing back. So then your brain might go back, and then boom. We don't. Our imaging, CT, MRI, it's amazing at a lot of things, but what we know is it's not at a point now where it can pick up on the nuances of those small microcellular changes in the brain. When someone hits their brain hard enough to cause bleeding or swelling, our imaging picks up on it. But by concussion, mild traumatic brain injury, by definition, you will not have positive findings on imaging. There's other injury parameters that we look at to diagnose, is this a mild traumatic brain injury? Is this a mild complicated? Is this moderate? Is it severe? There's a lot of things that we look at to classify level of brain injury. Concussion and mild traumatic brain injury is pretty elusive. Because again, you don't have to be knocked out to have a concussion. It's usually you get hit and you might have a couple of seconds of feeling like, I got hit. The next thing I know, I'm on the ground, but you weren't necessarily knocked out. I've seen athletes walking, talking, even continuing to play after they get hit. But if you sit down and talk to them, they're not making a whole lot of sense. And that's that post-traumatic confusion that's very common after concussion. But if that confusion resolves within 24 hours, it's consistent with a concussion. So I don't think a lot of people know that. I think it can be pretty scary. But again, not everyone's getting knocked out, so not everyone's going to the emergency room, not everyone's getting checked out.
Issues applied in Ecuador. Severe head trauma is the leading cause of death in young adults. In our country, according to the latest data provided with the WHO 2009, the mortality rate due to trauma in Ecuador is 60.9 per 100,000 inhabitants. Most of it due to severe head trauma.
As a family member of an individual with brain injury, what you really want to look for is a rehabilitation hospital that has specific expertise in dealing with traumatic brain injury. There are very unique considerations to the brain injury patient as compared with your standard inpatient rehabilitation patient. And having a rehabilitation unit that's specifically dedicated to brain injury can be instrumental in recovery. And at Moss specifically, we have a dedicated inpatient rehabilitation unit that has, a real high concentration of expertise. We have 3 doctors on the unit that are all board certified in brain injury medicine, and you have a lot of folks here who are really passionate about moving their field forward. And I think that's the secret ingredient. On the inpatient side, we use a lot of the robotic-assisted devices to help with the upper extremity in folks that have difficulty moving or coordinating their upper limb after a brain injury. And then as people progress toward outpatient, we do have the availability of a lot of robotic-assisted therapies for gait training. But by and large, it's the experts, it's the therapists and the doctors that are all working together to apply these technologies that really make the difference. Our ultimate goal is to maximize their independence, and that means it may start with just being able to communicate basic wants and needs, to being able to transfer from a bed to a wheelchair on your own or with as little help as possible, to being able to walk without help, being able to get dressed by yourself, ultimately being able to go places by yourself, being able to get a job. Patients who go back to college eventually, or go back to some type of vocational school. So all of these things, being part of their journey, I think, is a privilege and an honor. I work with people who are like-minded and who are also passionate about this and who are smart and good at it.
Conclusion. Craniocephalic trauma is the main cause of death and disability in previously healthy young people. The repercussions of traumatic brain injury affect not only the physical but also the cognitive, social, and economic aspect of the individual, with the consequent impact on society.
Traumatic brain injury, or TBI, is an injury that disrupts the brain and its activity. TBI can result from a blow to the head, a jolt of the brain, or an object that goes through the skull. In the United States each year, 1.7 million people sustain a traumatic brain injury. Each of these heads represents 20,000 people. Of the 1.7 million injured, 50,000 people die, and more than 250,000 are hospitalized. TBI can be mild to severe. Severe TBI can lead to permanent disability and even death. 75% of brain injuries are mild, meaning they are not life-threatening. In the U.S., most brain injuries in children, 55%, are caused by falls. 24% are caused by being hit in the head with an object, like a soccer ball. Among children older than 5, car accidents are the number one cause of TBI-related death. Assault is the number one cause of TBI-related death in those younger than 5. But even mild brain injury, like a concussion, can seriously affect daily activities. Mild TBI can cause problems with a child's speaking or understanding, movement, thinking or memory, and personality or mood. We can all help reduce the risk of TBI in children. Use a safety seat and/or a seat belt when the child is in a motor vehicle. Make sure the child wears a helmet when riding a bicycle, skateboarding, and playing sports like hockey and football. Install window guards and stair safety gates at home. Avoid shaking or jolting a baby. To learn more, visit nichd.nih.gov.